The most common place for skin cancer is always going to be the head and the neck. Sometimes in women it will be a bit more common in the lower legs. In other men they have a bit more frequency the women to have it on their backs and their trunks. Obviously in sun exposed areas it's a bit of a higher risk, but we do get sometimes skin cancers on the foot where you might not get much sun on that at all. Just last week I found a skin cancer on a younger female with a thick head of hair, and it was just hiding towards the back of the head there, and even with all the hair in the way she still developed a skin cancer there. And that's something that we don't always think about, particularly when we put sunscreen on. We're not always going to be wearing a hat when we go outside, or protecting our scalp, protecting the bottoms of our feet. So part of my job is to look in all the spots that you're not really looking at. In general, skin cancer is much more prevalent in men, as we find, but the types of skin cancers that appear are different between men and women, and between different ages of men and women as well. Often we find that younger women might get a certain type of superficial skin cancer a bit more frequently, and as you get older you might get a bit more of a aggressive sun damage type of skin cancer. It is useful to do a self-check or get your partner to check every so often. So if you're doing a skin check every 12 months, maybe every 3 months you might have a look. If there's any lesions that you're particularly worried about, I always encourage you, you're welcome to book in for a spot check. Come in for a quick check, and we can always look at the spot that you're really worried about in between your skin checks. If you've got someone at home, I do encourage for partners to have a look through the hair where you definitely can't check yourself, and get someone to check your back for you where you can't check yourself. Other areas that you can look at, you can always have a look in your mirror. Most important thing is protect yourself from the sun as much as possible. I always give lots of information about skin cancer advice. It's already readily available, but patients have certain concerns about how to use sunscreen. Chemicals in sunscreen is a big topic at the moment as well, covering up and things like that. I always run you through that.